We're excited to share this new budget advocacy framework with you. If the global COVID epidemic has taught us anything, it has shown us the importance of strategic investments in health and health infrastructure. Every government, wealthy or not, has seen the devastating impact in terms of lives lost and domestic economies shattered. In order to ensure that investments in strong, sustainable health systems with the capacity to respond to new and existing threats are there, we need sustained funding. Local and national advocacy is how countries can keep attention on the need for strong public health budgets. This framework is meant to help civil society advocates, policymakers with a step-by-step process for getting there. As the video mentioned, the Global Health Advocacy Incubator supports civil society organizations that advocate for public health policies that reduce death and disease. We've done that in diverse countries and political systems. Our budget advocacy framework has been informed by our strategic approach to policy change. It is rooted in our support for successful, locally led campaigns. This framework is based on our close work with government and civil society leaders in Nigeria and Senegal to make the case for epidemic preparedness. The goal of the incubator's Preventing Epidemics program is to end the cycle of outbreak panic, followed by policy and funding complacency. In Nigeria and Senegal, we supported civil society and key government agencies to build political awareness and support for government investments in epidemic preparedness. This framework includes 4 steps. Step 1 is planning the budget campaign. We support local partners to plan a comprehensive political strategy by conducting a political and legal landscape analysis, mapping key stakeholders, and building a strong, locally grounded case for increased investments in epidemic preparedness. In our experience, it is important to build both a strong public health case as well as an economic case. Step 2 is conducting the campaign. We worked with local technical experts to build a multi-sector coalition to meet and engage with policymakers and generate media coverage. Our local partners work to highlight and amplify diverse voices to bring urgency for the need for increased funding. Step 3 is strengthening accountability. Once resources are allocated, it is critical to track budget allocations and spending to identify bottlenecks in getting the resources where they are most needed. Budget transparency is key. Our partners stay on the job to ensure effective use of often hard-fought-for resources. Step 4 is promoting budget sustainability. This involves conducting program impact evaluations and assessing budget needs for the next budget cycle to sustain and increase the investment in the medium and the long term. This framework was not only built based upon our successful budget advocacy campaigns in Nigeria and Senegal, but also campaigns for public financing for hypertension services in India, maternal and reproductive health in Tanzania, and drowning prevention programs in Vietnam. We invite anyone watching to download the framework for free at www.advocacyincubator.org.